There's multiple waves of the pandemic. We think about the clinical aspects of it as we were working to prevent people from getting COVID and then figuring out how to better treat them and then prevent them from getting it through vaccines. And now we're actually seeing other consequences of the pandemic. And those relate to some of the financial issues that many hospitals and healthcare systems are facing. They relate to pent up demand for certain types of care services or deferred or delayed care. We are definitely seeing sicker individuals come into our hospitals, into our clinics, and some of that may be due to the fact that they deferred or delayed care during the pandemic. And so it's really important that we have the right access, that we're able to treat individuals and identify any conditions that they may have as early as possible. But because of that increased severity of their conditions, it's really adding extra stress to the workforce and how we take care of our communities. One of the things that we're facing now is really some of the financial pressures on health systems and hospitals. And there's many reasons for that. But really what's happening is that the cost of care is getting higher and higher. And so what we were able to produce in terms of health before is now costing more. And that's really challenging, especially for some of our critical access hospitals, our community hospitals that are really the sole providers for a population and a geography. And so it's really concerning for our frontline healthcare workers and for many of our administrators of how do we make sure that these sort of pressures do not prevent or limit services and access to necessary care for our communities across the country. It is inherent in healthcare workers to provide care. They go into these roles to help people. They want to help someone. And some of these financial pressures are really making it hard to do that. One of the other things to consider as we think about the financial pressures that are really facing hospitals and health systems is the impact it could have on health equity and health disparities. Because we know that some of the hospitals that are the most impacted are in those communities and serving those populations that really are vulnerable. And so we need to really think about that as we continue progressing down this pathway of financial pressures. Some of those services and access to care may be curtailed in our most important facilities that are serving some of our most vulnerable populations. So it's really important to recognize the health equity aspect of what's going on as well.